Welcome to our public affairs program, The Sounding Board. We're joined today by Congressman Brad Wenstrup, who represents a good bit of our listening area in Congress. So, Congressman, good to see you. Good to have you back with us.
Good to be with you, Mike.
I know we've tried to touch base every time that you've been good enough to stop by for an interview on the latest at Piketon. We've been trying to follow it on the news, but what is the latest in relation to language out of Washington that deals with funding for the cleanup operation?
For the cleanup, we had recommended a higher figure, at least myself and Bill Johnson, from the area, Congressman Bill Johnson. There's still a fair amount that the final bill recommended, which was $214 million for the cleanup and $58 for the on-site disposal cell, which came to $272. We had recommended $314 million. We may have to work with the $272. Senate Appropriations Committee recommended even less than that. So we're going to continue to try to keep the funding up there. You know, Mike, as well as I do, that the longer we take with this, the more expensive it actually gets. And so we want to keep that workforce full force so that we can revitalize the area, which I think has tremendous opportunity down the road.
The idea or the proposal that was floated a number of years back that they would have new technology come into that plant. Is it my understanding that before that could ever happen, that the waste would have to be cleaned out of there?
Well, to go full force, I think you do need to get that out of there. I mean, I'm encouraged that some of the on-site disposal can take place in this area, not only for the jobs, but I think that once you start that, it makes it a stronger argument to keep the process going at full force. We may want to talk a little bit about Centrus and what happened there. The Department of Energy has decided we don't need it anymore. It was very interesting because I was on with the Department of Energy Secretary Moniz, and I said, well, as you made these decisions, even though Congress approved continuing its presence there and its operations there to a degree, we did that for national security reasons. But I said, did you weigh into what it cost to shut it down? And I said, what is that number? And he said, well, that's a good question. And I thought that should be really a big component of what you're deciding to do. But I give the management credit there and the workforce there. They're those they've had to let go. They are managing that very delicately, and they are trying to find outside sources of revenue that they might be able to fill. But I think it's a matter of national security that we have a domestic source of enriched uranium. The DOE says, well, we've got enough tritium that we're all set, and that should help our military keep them going for years to come. But I'm concerned that we don't have that up and running. This is not a workforce you can just put together very quickly. And so we're going to continue to seek that. Now, they had a report saying why they don't need it, but we've asked in the National Defense Authorization Act for an outside opinion because they're just deciding that from within. So Congress, the representatives of the people, felt it was important, but DOE does not. And well, that can get me into a whole other topic, Mike, about agencies seemingly having more authority than the elected representatives, and we've got to change that too.
And speaking of that, we are coming up, obviously, on a presidential election. Could that policy change with the next president, whomever it would be?
Well, I think it needs to, and we may have to codify that in law, I would hope. Article 1 of the Constitution says that all of our legislation will come from a Congress made up of a House of Representatives and a Senate. What we're dealing with today is agencies that set regulations that have the rule of law, and these are things we've never voted on. And this is frustrating to people across America, whether you're a small business, large business, all these things, banks, whatever. Rules come out. They say it's the law, but it's not anything we've ever voted on. And we passed the REINS Act in the House in the past that said that Congress will have to approve new regulations, and I think we need to do that full force. I'd like the American people to realize that that's not what you learned in your government books, but that's what's taking place today. And it's hard to represent the people you represent when decisions are being made by people that aren't elected.
We alluded to the presidential election. It looks like Donald Trump will be the Republican nominee for that. Some Republicans in elected leadership positions have already stated they're not sure whether they can support him. Speaker Ryan says, I can't make that decision yet. Past presidents Bush and Bush said they would not. Where does Congressman Wenstrup stand on that issue?
Well, first and foremost, I've got my lane to be concerned about first, and that is get reelected myself and continue to push the things that I think are best for America and best for the 2nd District of Ohio. And that's my first and foremost priority. At the same time, what you're seeing today under Speaker Ryan, and he said this before we knew how this field was going to end up, he said, we're not going to wait for a presidential candidate to decide what our priorities are and what our platform looks like. So we put together task forces that are going to be coming forward with what we in the House of Representatives feel is good for America. So we're going to deal with things like national security. We're going to deal with tax reform. We are going to deal with these types of issues so that we can move forward and say this is what we stand for. And I think that Speaker Ryan, I can't speak for him, but I think what he's saying right now is, look, we're going to put forward our agenda, and we're going to hope that we have a president that agrees with our agenda and set the right priorities for America. And so, like I said, that's what I think you're going to see more of coming out of the House of Representatives anyway.
So you believe that whoever that president is going to be, that the Congress will take back the legislative lawmaking process and take it out of executive order hands?
Well, we'd like to do that. I mean, it really is frustrating, and that's something that I just learned firsthand. You know, this is my first elected office. I'm a doctor, a soldier first, and coming into this, you know what you learned in school, and you started to see this. As a business owner, I felt the regulatory field of Washington coming down upon us all the time. But you really realize it firsthand that they're acting on their own and really falling under the executive branch, which gives way too much legislative authority to one branch of government, which our founders did not have in mind. So that's the Article 1 component that's part of our agenda in Congress. We're going to talk with about healthcare reform or replacement for Obamacare to get more people insurance affordably and access to care and have better long-term plans and options on their care. We've got an anti-poverty program that we want to put forward. That really doesn't get talked about much. So, and as I said before, tax reform and national security are important to us.
For our listeners just tuning in, we're talking with Congressman Brad Wenstrup. He is our guest today on the sounding board. As you know, Congressman, the drug problem that we have in our nation is as bad as I've seen it in my 56 years of life. And even in our southern Ohio community, sleepy little rural America, it's a devastating problem for many people here. We're seeing the state pass laws where they're telling doctors you can only prescribe X number of opiates at a time, for example. Is that something that we need to also do on the federal level?
Well, we're going to see a series of bills coming out of the House next week. They're going to deal with things like overprescribing and mental health and rehab resources, as well as taking care of children that are born to a addicted mother. So those are some things that you're going to see and also as far as care for those that are engaged with this. Most of this real effort has to be long-term in prevention, I think, as much as anything else. I mean, you have every component to consider when it comes to this. You've got how is it getting into the country and securing our borders in that regard. How do you prevent someone from starting? What are doctors doing? You know, as a doctor, I was always very frugal. I actually had somebody compliment me recently where I was told this woman was addicted. She had come to me as a patient trying to get drugs, and she's clean now, and she said, thank you. You didn't give me any. But we have opportunities, too, to see what other doctors are prescribing, and that was always a part of the equation, too. You know, you'd go from one doctor to the next trying to get a new prescription. Doctors need to be aware of this. But this is something that was driven within our country for a while, that the notion that no one should ever be in pain. And it's not like we want people to be in pain, but pain is a natural response to something. And as a physician, it's a marker to you to tell you where somebody is when they have a problem. So you can use pain medications, but use them frugally and use them wisely, and not to the point where you get somebody who is hooked on them.
You're close to my age, so we can remember this time. There was a day when you could not advertise prescription medication on radio, television. Since, I'm not blaming it on advertising altogether, but it seems like we're seeing so many advertisements and hearing them where doctors have told me that they have patients going in and asking for what they've seen and heard. Are we culpable too?
Well, to some degree, you make the case, but I will tell you, it's an interesting time. I am 1 year older than you, and so in that regard, things have changed so much, because not only do you have the commercials that drive people to you, but you have the internet, and people will come in, and this never happened in my early days of practice. They'll come in and say, "Oh, doctor, thanks. I know what I have. Here's what I need."
Right.
And like, wait a minute, I haven't even examined you yet, and you're telling me what you have and what you need. And so it can make it challenging sometimes. And sometimes you say, yes, that is correct. And other times you say, oh, that's not quite right, and here's why. So there could be a lot of influencing factors on this. I think what we need to be advertising right now is that we care about your pains and your concerns. We don't want to make you worse off. And let me tell you, this has affected a lot of people. It has nothing to do with how rich or poor you are or where you live. We have people today that are dependent on drugs, physically dependent on drugs, and they never intended to be. Right. And they came about it very innocently. Others came about it through recreation.
Just before you came in, we've only got like 2 minutes to go, but just before you came in today, there was a report of a mass shooting in Maryland. The last time you were here, we were visiting and talking about mental health in connection with gun violence. Has there been any movement, legislatively speaking, on that front?
We've got Tim Murphy's bill. Tim Murphy's from Pennsylvania. He's a psychologist. He's written a very good bill. We have done things that limit people's access to mental health care and limit their families from being engaged with that health care. And so today, under current rules, because of privacy, if you see a family member of yours that is saying things, doing things, and they need mental health, it's very difficult for you to get involved with getting them into care because it's a privacy thing. And so we're trying to loosen some of that up and let doctors make good decisions when they deal with patients' families on how to get people into care. Beyond that, we also have put in through Medicare penalizing hospitals if they have too many beds for mental health and rehabilitation. And so they've driven that out into the community, and so you have a lot of people on the streets that are in need of care that don't have access to hospitals because it was 16 beds, and if you go over that, then you don't get paid for any of it. So people just dropped it. When I first started in practice, I would see patients on the psych floor, as it was called. You may want to change the name, that's fine, but nonetheless, those have essentially gone away, and we need to have hospital care and then good transition care back to the community.
Congressman, as always, it's good to have you in Chillicothe. You're always welcome on the show.
Thank you, Mike. Great to be with you.
Congressman Brad Wenstrup. He's been our guest today on the Sounding Board.